Mic check, test 1, 2. Check, check, check. Maybe we'll get some audio this time. Check, check, mic check. 1, 2, 3, 4, 5, 6, 7, 8, 9. We got it? Nice work, Laura. Oof.
Okay. Good afternoon, everyone. I want to thank you for being here. My name is John Vitolkis, County Manager. I'm joined by the Henrico County Sheriff Alisa Gregory and Dr. Melissa Varay, Deputy Director of the Richmond and Henrico County Health Districts. As we have throughout this pandemic, Henrico County has been committed to protecting the health and well-being of those in our community. That's why we reached out and offered help obtaining PPE when our nursing homes and assisted living facilities were struggling with early outbreaks, if you recall. And that's why we initiated mass testing of our police officers, firefighters, and other first responders, including GRTC employees and others. We wanted to be certain that those entrusted to protect and care for the community were safe to do so. And that's why we have distributed about 30,000 COVID care kits to our residents. And that's why we moved aggressively when we learned this week that COVID-19 had reached our jail population. I want to thank our Sheriff, Alisa Gregory, for her leadership and reiterate that Henrico County is committed to doing everything in our power to address this situation. And I want to note for the members of the press that since Alisa Gregory has come on as Sheriff, she has been able to reduce our local inmate population to a level not seen You'd have to go back 15 years to see those types of numbers. At the same time, we're prohibited from moving any state responsible inmate from our jail. And those numbers, sadly, are the highest that they have been in years. I also think, and you will hear that it's important to note, that of the positive cases that we're getting ready to share with you, the vast majority have been asymptomatic. 8 inmates are affected with mild symptoms of the disease, and none have been hospitalized. But let me be clear, going forward, for the residents, for the families, for anyone that is affected, our support, Henrico County's support, is absolute. We are engaged and ready to mobilize whatever resources that we need and are needed here. At this point, I want to thank Alisa Gregory. Ladies and gentlemen, the sheriff of our county, Miss Alisa Gregory. Alisa?
So, good afternoon. I'm just going to take off one mask. Thank you, Mr. Vitokis. The Sheriff's Office understands there is a concern throughout our community about the COVID cases in the jail. I want to thank the county manager for his support and reiterate that we are doing everything in our power to contain this outbreak. We are absolutely committed to protecting the health and well-being of those in our custody, as well as our staff and our contractors. From the onset, we have worked closely with our county and the Virginia Department of Health, and we will continue to do so. So I'll give you a little background information. On July 5th, 3 inmates at Jail West were confirmed positive for the coronavirus after exhibiting mild symptoms of the disease. They were new to our jail and had passed an initial screening for COVID before being housed as a part of a larger isolated group of new inmates. As a result of these confirmed cases, we quarantined the 3 inmates in individual cells and immediately initiated testing of all inmates and jail staff, including our contractors who were potentially exposed. On July 10th, we were updated with the fact that we had 43 additional inmates confirmed positive for COVID. So we expanded our testing again, this time offering to all inmates and staff at both our Jail West and Jail East facilities. As of this morning, we have tested a total of 645 inmates. Of those, 125 have been confirmed positive for COVID. In addition, 393 inmates refused to be tested. We are also tested 270 members of our staff. Of these, 6 were positive for COVID. We continue to test new committals to our facility, and we will continue to do so on a daily basis.
At this point, ladies and gentlemen, I'd like to offer any questions that may be coming forward. Dr. Verret is here to ask any question or answer any question regarding public health. But as you heard the sheriff note, the overall number that we have now that have tested positive is 125, and you will see testing going forward on a as-needed basis. We know that we are going to be testing every inmate and staff member at least weekly. So I'll open it up to any questions. Hang on, right there. I'll let the sheriff, you want to do it? Go ahead. Melissa, come on forward.
Hi, it's Melissa Verret from, let me do. So in terms of the response, we are still in the midst of an investigation because remember, we just learned about these recently, and as we work with the sheriff, we are working to identify what we can learn about, both about what has happened and making sure that going forward, we minimize any risk for further transmission. So that is still a work in progress.
I'm- No, it's both Jail West and Jail East. So here's the thing. We learned a lesson at Canterbury, right? And we went into Canterbury, it was early on, it was mid-March, and we were advised at that point, you don't need to test everyone. And the reality is we needed to test everyone back then. Now, we know that we should be testing everyone here, and that is the first thing that we did and the first thing that the sheriff put forward. We will continue those tests at least weekly, but on an as-needed basis as well.
So, anybody that refused testing in our staging areas, meaning they hadn't been through the quarantine period and were still in those quarantine stages, we treated them as if they were positive, okay? The only folks that were able to opt out of the testing were folks that, and didn't get treated like they were positive, were folks that have already been through the quarantine period, have been with our facility for an extensive amount of time, and have no symptoms. And I add that the fact that out of the 125, there are very few, less than 10, that have any symptoms other than mild symptoms at all.
So the question is, of the 125 that have been tested positive, how are we treating those 125?
So they are being housed separately from all of the other inmates that are in the quarantine phase. The folks that are positive are housed in a different area, separate cells, and then the negatives are still, but everybody is still quarantined.
I do want to make one clarification to what Sheriff was saying. When it comes to the individuals who refuse testing, they are not being housed with known positives. So they are being separated. They are being separated from others and from the folks who tested negative, but they are not being housed with positive known COVID-infected individuals.
Thank you, and that's a very important point because that is literally a third group of individuals. One point that I think as the county manager I need to continue to acknowledge is that at this point last year the population in this jail was approaching 1,700, and what we have today is in the 1,100 range. So since coming on in January of this year, the new sheriff, and especially with the outbreak, the COVID outbreak, has made concerted efforts with the judges, with multiple agencies, the Commonwealth's Attorney's Office, and all others involved in judicial administration to reduce those numbers. So, if there is a little bit of comfort that can be taken away from having 1,100 as opposed to 1,700, because we would not be able to do some of the things that the sheriff is doing to isolate, to create a third group of inmates if that wasn't the case. So thank you again, Sheriff Gregory. Any other questions?
So you want to know why so many inmates have refused the testing. I cannot give you an exact number, an exact reason. Some people are fearful of the test. I myself have been tested, and when asked whether I wanted to have the nasal swab or to have the test that the back of my throat, I had the back of my throat every day. It's an uncomfortable test. So I can't give you an exact, but I would speculate that the test is an uncomfortable test. And like in the community, there are people that have no symptoms that feel like, I'm okay. Why do I get a test? But that's the scary part about this. You know, you have a bunch of people that have tested positive that are asymptomatic. Is that what's happening in our community? You know, that's why it's so important for people to wear face coverings. If not for themselves, for others. We got to protect one another. So we will, because just like we're sharing with you, I continue to tell the county manager that we are open book. You know, we have to learn from each other. We have to share information. We have to share our experiences. So I'm hoping with sharing it with them the results of the test and the fact that some people are testing positive and they're asymptomatic, it will encourage them to step up and take the test and know. You know, no one's half of the battle. That's how we were able to jump on it and treat it and prevent some people from getting deathly ill. Okay? So we're going to keep encouraging.
So ladies and gentlemen, thank you for coming out. But before we close out, this is Henrico County. And any family member that has a question about an individual that is housed at either Jail East or Jail West may call the sheriff direct at 501-4570. So please put that information out. The county manager's direct line in Henrico County is 804-501-4386. Both numbers are available. Anyone that has questions, please reach out. We'll do everything we can to answer individual questions. And thank you for coming out and covering this for our county. Have a good afternoon.